the work that you, the people and local organizations do to receiving migrants and refugees that move from different, to move because different crises is life-changing, is life-saving task. And it happens close to us, geographically speaking, and it also happens far away, but very close to the heart. And in this way, I'm going to give the word to María Alejandra. She's a lawyer of Sisma Mujer from Colombia. And they do, well, I think María Alejandra can explain better what Sisma Mujer does to work with migrants and refugees in this zone. Please, María Alejandra, go ahead.
Hola, muy buenos días. Muchísimas gracias.
Good day. How are you? Thank you so much for the invitation to be a part of this session. The organization Sisma Mujer is a Colombian feminist organization that has been working for over 25 years to advocate for the rights of women and girls in the private and public realm. We have identified in the migration of Venezuelan women to the country that women and girls are at a very high risk of suffering violence and discrimination related to the vulnerability of migrants. And this, of course, articulates with their gender. And this is an evidence that we need to incorporate our specific experience of girls and women in the design, implementation, and assessment of migration policies. So in this sense, I want to share with you my presentation from my own lens of perspective, from the psycho-legal perspective on women and gender, so that we can share Venezuelan girls and women's migration experience to see the migration policies from women's and girls' perspective. So first, I would like to tell you how violences identified in Sisma that girls and women migrating to our country suffer. We have xenophobia or racism as one of the most notorious and explicit forms of violence, because girls and women with which we have worked with have said to be victims of aggression and discrimination because of their nationality on the streets, in schools, labor environments, even in governmental institutions. These are xenophobic expressions with different levels of violence that negatively affect women's and girls' experiences, and they generate insecurity, frustration, and anger. So this situation worsens if women and adolescents from Venezuela are approached through stereotypes, women from hypersexualization that expose them to expressions of violence that they encounter, such as sexual harassment and violence. Also, it's important to add that the social and economic situation of migrant and refugees from Venezuela in Colombia is quite precarious. That is to say, migrant girls and women are undergoing extreme dispossession or poverty, and this leads them to have many difficulties to have access to jobs and employment. And of course, we have labor violence. They have related their experience with the non-compliance of salary payments, salaries that are quite below the average compared to Colombian women citizens, different job descriptions, and they need to stay overtime without extra pay or extra overtime pay. They have described threats and verbal violence related to their gender and nationality in the workspace. And because of their irregular situation in the country, because of their migrant condition, and because they need to survive and provide food to their families, employers take advantage of this situation. And many times they are forced to accept unacceptable conditions. Another violence scenario has to do with intra-family violence. First, we were able to identify that there are more issues in accessing the legal system or the judiciary if they're migrant, because they fear that their reporting might have a negative effect on their migration and regularization processes. And also they feel quite a lot of fear because government officials might make decisions on their rights regarding their children, and they might curtail or restrict these paternal rights. And also, sometimes there's a doubt as to who is the aggressor and how sometimes the government and the legal system has some restrictions. That is to say, if the aggressor, and this is in our experience, if the aggressor is a man, also a migrant, the women have a feeling of impunity. Sometimes when they address the legal system, once they're victims of intrafamily violence, they have found no positive response, in as much that the government says that it's difficult to take the aggressor to court because he's a migrant as well. So they must give up in their reporting. And sometimes if it is a Colombian man, the aggressor is a Colombian man, there is complete asymmetry in their access to rights. They are fearful that they will prioritize the aggressor's the Colombian nationality, and that in an eventual going back to the countries, they won't be able to take their children back with them because of this reports. And also, we find sexual violence and sexual harassment. This, of course, even worse because of these hypersexualization that fall on Venezuelan girls and women, because they come to our country, Colombia, in vulnerable conditions and with a lot of vulnerabilities in their access to rights because they're migrants. And these sexual harassment and sexual violence are within some barriers to have access to sexual and reproductive access. According to our Colombian Health Ministry, most of migrant persons who are victims of sexual harassment or violence are women, 81.1% of the recorded cases. And sexual violence has a high degree of underreporting because of obstacles to having access to the judiciary. Another violence form quite explicit in our society, and which is a latent risk, is person trafficking. According to our committee in the capital city of Colombia, in Bogota, the fight against person trafficking is one of the biggest challenges, not only in the city, but throughout the country, because 70% of drug person trafficking are women, and most of them are sexually exploited, followed by forced labor, followed by servidum, and in other cases, we've had early and forced marriages. Also, we have other kinds of violences, such as psychological violence. Migrant and refugee women and girls are under high risk of psychosocial violence that then spins off First, because of the imbalance, social, psychological imbalance from having to leave your family behind, your home, your traditions, your work behind, but also as a result of how difficult it is and how risky it is to adapt to a new destination, where you're also encountered by stereotypes and violences that exacerbate vulnerability conditions, generating stigma and restricting their rights. And in the third place, because of the difficulty in being able to regularize their migrant status, and then they do not have access to health, work, and education because of this lack of regularization. And many challenges have been identified by our organization in our work with migrant girls and women. This requires more effort to be able to articulate our borders opening speech and discourse with the enactment of human rights. It's also important to understand that legislation and public policies must specifically name girls and women, something that's not happening in my country. And this leads to the non-identification of vulnerable context for girls and women who migrate to Colombia. And as a consequence, you cannot have an effective response and protection of their rights. It is relevant to say that we need to have clear guidelines for refugee girls and women. And it's necessary to have clear indicators that focus on gender issues and vital cycles that are clearly stated in the budget and that are a priority, especially on gender issues, to be able to answer the demands of girls and women that are refugees. Our response as Sisma has been a compilation of a number of relevant issues. The first one is to train public officials on migrant and refugees' rights so that they can identify and respond the specific barriers that girls and women face in their access to rights. They need to promote information to the access of rights of migrant women and girls, and they have to establish information channels that are aimed at these women and girls. And the third recommendation is to take immediate action to do away with the xenophobic discourse from public officials. And we need to also move our advocacy to avoid political parties to adopt xenophobic standpoints, and we need to generate territorial security. And of course, security is a logic for migration in Colombia. We need to guarantee integral and comprehensive care with a gender viewpoint in everything that involves refugees and migrant persons. It is also important to update public policies on migrant persons, coordinating action plans with a clear budget. And the main aim is to have migration governance with a focus on human rights and a gender focus as well. We need to enable the regularization processes for girls and women, promote visas and different options for these women who have been victims of gender violence. And we need to promote an active search for women who have been victims of person trafficking in all of its forms. And we need to incorporate these decisions, the international courts on the issue of migrant rights, to incorporate them into our policies, specifically focus on girls and women to improve our migration policies in our country. Ninth, we need to promote actions to warranty access to prevention, protection mechanisms and protection of their rights if their rights are in danger. And finally, it's important to review the legislation on refugees, especially internally, to be able to characterize women, give them a name, and adopt mechanisms for the management of their lives and their rights. Thank you very much for giving me this opportunity.
Thank you very much, María Alejandra. I think there are really extremely important points, especially when it's in the construction of feminist foreign policy, of what we all together can do, especially if it's, I mean, for every kind of crisis, immigrants and refugees that we have, from the Congo crisis for climate crisis. It's an important point that we need to take into account and we to highlight in these collaborations that we're having.